Okay, good morning. It looks like we've slowed down. Well, good morning, everyone. Thank you so much for joining us this morning. I'm very excited to be able to present our 10th annual KHI eHealth Summit to you in collaboration with the Kentucky Regional Extension. It's really strange not getting to see your faces. I'm used to the summit and being on stage, and although the fluorescent lighting is a little easier on the eyes than the spotlight from the back of the room, it's still odd to not see your faces. So I encourage you to interact with us in the chat boxes throughout the day, attend some of the networking sessions, find ways to connect to not just KHI and our staff, but to other participants as well. It's although it's strange times and it's a little bit odd to transition to a virtual platform, it's been incredible to see how technology can be implemented and help make such a huge change and still allow us to continue moving forward. And in many ways, propel us to new levels. Um, Being able to provide this to you virtually, what we have seen has allowed us to reach participants to join the summit who have historically not been able to attend because of travel costs or timing constraints. So we're excited to see how technology inserted here into this format is going to make some significant changes for our Health Summit this year. And we're just excited. So again, I welcome you. Thank you for joining the day with us. Bear in mind that is a virtual platform. We are going to have technical difficulties today. And so just kind of bear with us as we work through those. This is a new platform to us. It's using Zoom, so hopefully things will flow pretty seamlessly. But who knows what we're going to encounter. So we will all be in this together today. So before we get this started and before we jump into some of the other slides, I want to go through some thank yous. Okay. First is the Kentucky Regional Extension Center. We could not have put on this summit without their partnership and collaboration. We partner with the REC on a lot of different projects, also with the Meaningful Use Promoting Interoperability Incentive Program. But this was a first for us to collaborate on the eHealth Summit. And so we're grateful to Brent McCune for allowing to work with us, allowing his team to work with us and collaborating. I know that I have not made it very easy on them, but they have been tremendous to go along with me and my team as we've moved forward with the eHealth Summit and navigating kind of how are we going to present this content this year. A few other from Brent's team, Mindy Ross, Catherine Shaw, and Brent Doom have gone above and beyond at helping us to find the platform that we're using today, put together our content, help us put together the boxes and the gifts that you should have received, and coming up with our eHealth Summit logo. So just very appreciative to everyone at the Kentucky Regional Extension Center and always thankful for their collaboration. Next, I want to recognize our diamond sponsor, Deloitte. Deloitte is our technology vendor for the HIE, but they are truly so much more. They offer to us much more than just technology. They offer their support, their partnership, their collaboration in everything that we do within the HIE, and we're fortunate to have them as a partner with us. And they also have stepped up and gone above and beyond with helping us to put together the eHealth Summit this year. They've helped us get access to speakers. They've helped us financially to pay for this, and they've provided some of the gifts that we'll talk about in a little bit. So very thankful for Deloitte and their we have two anniversary sponsors with us, Aetna and WellCare. We've started working with Aetna and WellCare years ago and are continuously building our relationship with them and coming up with creative ways for how that we can continue to collaborate. So we are very thankful to have them with us and thankful that they are helping to sponsor the summit this year. We also have a great list of exhibitors. And so I'm thankful for all of these people. I encourage you to make your way to the exhibit hall and chat with them. They are ready and willing and excited to offer you resources on their programs, talk with attendees. So please be sure to go and visit these exhibitors in the exhibit hall. We're thankful for all of them and for their continued partnership, not just for the summit, but throughout the year as well. Next, I want to thank our KHI Summit team. This group of 4 individuals have gone above and beyond this year. Every year, it's just incredible what they are able to put together for you for this summit. But this year, transitioning platforms was exceptionally difficult and had us moving into uncharted territories. So recognizing Brandy and Teresa and Brannon for putting in long hours the last couple of weeks and working on this for several months to be able to deliver this to you today. Very grateful for them. Also, I want to recognize the rest of our KHI team. They are, I feel so lucky to be able to work with such a great group of people. They are just tremendous in how they support us throughout the year, how they're able to work with participants. And even though many of them are new, and for many of them, this is their first eHealth Summit, I'm grateful for everything that they do for KHI and how they support our technology, how they support our participants, and then also for how they're helping to support the summit. Many of them will be in vendor huddles, and so you can talk with our OA technical team if you go into the networking lounge. And so I encourage you to make your way into that room to talk with them. But again, just a thank you for all of their support for the summit and then for everything that they do throughout the year. Okay, now we're going to jump into a little bit about where we are with our 10-year anniversary. So this year marks a celebration for us. It has been 10 years since our first connection went live technically within KHI. And so we are celebrating a decade of connecting Kentucky healthcare. Now, while we're recognizing the 10 years and what has occurred in those 10 years and the network that has been built and the amount of data that we have consumed and the amount of data that we're moving, we also want to use this summit not just as a time to talk about those 10 years, but to talk about the future and where we're going. But I do want to take a few minutes to recognize some people who have helped to build the KHI that we are today. I do also recognize that many of you on this call and in this room probably know more about the history of KHI than I do. I think many of you actually served in many capacities in helping to develop KHI. We got our start out of the eHealth Network Board, and this was an initiative with Governor Fletcher, who was seeing the trends in healthcare and seeing health information technology as something that was emerging. And he started this board as an opportunity to make sure that Kentucky was not left behind, but not just that we weren't left behind, that we were leading the rest of the states with our health information technology strategic plans. So lots of members who have served on the eHealth Network board listed on this slide, countless number of hours contributed, and ultimately just tremendous what they helped to grow out of the seed that was started and to see how we have moved in the 10 years to today. Now the eHealth Network board is actually older than 10 years. They were put into place in the 2000s. So some of the contributions of these individuals go back 15 or 20 years. So we're very fortunate and thankful for this very forward-thinking group of people to have established us the way that we've been established to perform the duties and the roles that we perform today. Kind of moving from that eHealth stakeholder board into the coordinating council. This was a formal governance structure that was overseeing the implementation of KHI in the early days. So they were helping to shape policy, programs, technology, and providing a lot of expertise to ensure that we were building an HIE that would truly serve the citizens of the Commonwealth of Kentucky. And so again, very grateful and thankful and want to recognize all of these individuals for the time that they have contributed over the past 10 years to making KHI successful. Building on the coordinating council is the clinical advisory committee. This structure is still in place currently, and this clinical advisory committee has over the 10 years and still provides us a lot of guidance, support, direction, and firsthand and frontline knowledge and experience of what's going on in healthcare and health information technology, so that we can make sure that what we are building and what we are implementing is truly a service that is needed across the state of Kentucky. Thank you to the Clinical Advisory Committee members who are currently serving and listed on this slide. Now, over the course of the 10 years, we have had some tremendous leaders in the Cabinet for Health and Family Services that have helped to propel us forward. Even though we were started out of the governor's office and then moved into the cabinet, since being moved into the cabinet, we have had support across the board from all of the leaders who have served in the role of Secretary of the Cabinet, from Secretary Janie Miller, Secretary Audrey Haynes, Secretary Adam Meyer, and currently Secretary Eric Friedlander. They have all provided tremendous support to us, helped us to grow, and ensured that we are able to continue providing the services to the Commonwealth of Kentucky. I'd like to recognize them and thank you for their years of service to helping KHI. Next, I want to run through some of the executive leadership who have helped to usher us along as well. From my records, Jeff Brady was the first actual executive director and kind of was the starter of KHI. And then Polly Bentley had come in with Jeff Brady and later taking over as executive director, and really was the individual that oversaw so much of the growth of KHI. I think Polly and her collaboration, her initiative, her insight and knowledge of the industry and healthcare really is truly what I can point to as one of the success factors for KHI in enabling us to be where we are today. Serving with Polly was Carrie Banahan, who at the time was Executive Director of the Kentucky Office of Health Benefits and Health Information Exchange, and is now the Deputy Secretary for the Cabinet for Health and Family Services. During a transition time, KHI was fortunate to have Karen Chrisman step in and really take over and take the reins of KHI and continue and make sure that KHI was continuing to move forward during a transition period, not just for KHI, but for the state as well. So we're thankful for Karen's leadership during that time. And currently in the role of Executive Director for the Office of Health Data and Analytics, and serving as Executive Director for KHI is Robert Putt. Robert has been just a tremendous leader for KHI and myself to ensure that we are continuing to move forward. I'm grateful for his leadership and that he has been here through the transition, the technology transition, and that he allows me to fill the role within KHI that allows me to get to be here with you today. So thank you, Robert, for your leadership of the organization. Now, there are many, many other cabinet partners who worked and allow KHI to be who we are today. One of the biggest is the Office of Application and Technology Support. And through this group, we are able to have the resources that support KHI as the business so that we can continue moving forward with our technology. Jennifer Harp is the Executive Director, Marcella, the Deputy Executive Director, Lula, the Division Director, and I know is probably one of the people that I most aggravate in the cabinet. But Greg Martin, Mina, and then BJ Reed all make up the leadership of the Oates branch that, again, supplies with the technology resources, and we're grateful for their partnership. Now, this is just a few pictures of many of the other people. There are just too many to name who have been a part of the 10 years plus in building KHI. And we're just grateful for everyone's time and contributions. Lastly, we have a few team members who have given 10 years of service to the organization. Charlize Blair was the first employee hired to serve for KHI and is continuing to provide us her leadership, her guidance, her support, and expertise and experience in helping to make sure that all of the details are finely combed and approved and that we present as well as we do. Ann and Teresa both were added shortly after Charlize and have ensured that our outreach programs are of top notch and that we are communicating appropriately, and they just do a tremendous job in building rapport with our participants. So thank you all for your 10 years of service that you have given us. Now, as we kind of transition here, just a few ways that you can connect with us. So after today, we want to make sure that you know how that you can access our team and that you can, how you know how to contact us and start to engage with us for services or maybe new services. And so we have, over the last year, implemented a new website. I urge you to go there if you've not been there, khi.ky.gov. And then you can click on the Get Started tab and it will list the outreach coordinators and make sure that you know how to get into contact with our team. Our outreach coordinators are made up of Kelly, Teresa, Ann, and Tiffany, and can help and support you in getting engaged with us. Now, as a few housekeeping items, that before we kind of jump into the rest of the day, hopefully if you've made your way into the room, you have been able to navigate into the platform. You've seen the people running across the auditorium, trying to make this as real as possible. But really across the top, you'll see the ribbon that lists lobby, exhibit hall, auditorium. That'll be your main way to navigate around the different rooms. Urge you to go to the exhibit hall, speak with the exhibitors. The auditorium is how you can access any of the sessions. There's an exhibitor chat box. The leaderboard is exciting. So we are hosting a knowledge adventure, and you get points for everything that you do and for every way that you engage with us. So go to the leaderboard. It will explain what you can get points for. And as of right now, Stephanie Clark is in the lead with 18,700 points. And so congratulations, Stephanie, you're doing great. But check out the leaderboard throughout the day. We are giving prizes to the top three. And so we have a $300 gift card, $200 gift card, and $100 gift card for Amazon provided by Deloitte for the top three people with the most points throughout the day. So please continue to check that. With that, the Cabinet Secretary, Eric Friedlander, wanted to give a few remarks for the day and to welcome everyone as we kick this off. So I'm going to navigate to that slide.
Welcome to the eHealth Summit. Thank you all for coming. This is a very different way to attend, but I think we're all getting used to Zooming and Teaming and all the different things that we're doing to attend virtually. So thank you. Thank you for being a part of this eHealth Summit. And the E is important here. So 10 years ago, I believe was the first summit on eHealth. I think I was there, as a matter of fact. That's because I'm been around a long time. And who knew where we'd go in 10 years? We've come a long way. We've used the KHIE for a variety of things. Folks who helped us through the years, Polly who began, and the other folks who participated in eHealth and bringing up KHI. It's been a really important piece for Kentucky. And it's been really important in terms of where we are right now, how we've dealt with COVID, how we've used KHI to help us with that has been really critical for us. We've done some really amazing things. We've used KHI to onboard all our commercial labs so we can start to report electronically. That's really helped us as we've been able to talk to citizens of the Commonwealth to let them know exactly where we are in this pandemic. We've also used it for contact tracers and case managers and folks who have been managing these pieces all across how we've been responding to the pandemic. These have all been things that have been assisted and helped by KHI. So this is a very important thing for Kentucky. And we've come a long way, and we've made improvements along the way, and we will continue to do that. One of the most important things I've said, and I believe, is that we always have to learn. We always have to change. We always have to improve. And we've been able to do that, and we will continue to do that with your support, your wisdom, your participation, and your advice. So thank you for participating today, and we look forward to working with you and collaborating with you in the future. Thank you.
Okay, as we close this session out, we will end the session, and then you will either be navigated to or need to navigate back to the auditorium, and you will be allowed to enter the room for the next session. So thank you again for attending, and we'll talk with you in the next room. Thank you.